Hi, I'm Dr. Richard Cohn from the Cohn Eye Center in Maitland, Florida. Today we're going to talk about how to treat chronic dry eyes. Millions of patients each year come to their eye doctor with complaints of dry eyes. Everything from burning, redness, grittiness, itching, and even excessive tearing can come from dry eyes. Dry eyes typically get worse as we age, and they're a chronic condition that requires chronic treatment. In other words, there's no cure for dry eyes. There are several conditions associated with dry eyes, either underproduction of tears or over-evaporation of tears. More commonly, we see over-evaporation from blepharitis. Blepharitis is inflammation of the edge of the eyelids, the eyelid margins, in which patients have an increased oil thickness in these oil glands, and the oils don't flow well to cover our tears. If you don't have a nice oil coat on top of your tears, then your tears evaporate too quickly. We usually recommend the use of hot compresses, a hot washcloth over your lids at least once a day, followed by scrubbing of the eyelids either with baby shampoo or the use of a commercial scrubbing preparation available at the drugstore. These are all available over the counter. This is part of good lid hygiene, and lid hygiene should be done daily to help keep your oils flowing nicely. In severe cases, the ophthalmologist may recommend the use of an antibiotic or steroid eye drop. Many feel that the use of omega-3 fish oil supplements will help promote a better oil coat on the tear film. Other things that people with dry eyes should know is that certain activities can make dry eyes worse. For instance, using a computer. When you use a computer for long periods of time, your blink rate cuts down significantly. When you're not blinking enough, your eyes are drying out. So remember that blinking is your eye's way of lubricating the surface and keeping the surface moist. Also, certain things like ceiling fans, desk fans, and air conditioners blowing towards your face can also make your eyes more dry. Also, dry eyes are seen more commonly at high altitudes and in windy climates. Use of a humidifier in dry climates helps in dry eye patients. Poor tear production is also a common cause of dry eye and is seen in patients over the age of 50, in postmenopausal women, and in patients who have had LASIK. It is also seen in patients on certain medications like chemotherapeutic drugs and in patients who've had radiation treatments near the face or the eyes. We generally use artificial tears as a first-line treatment. These are available over the counter, and there are many different types. I recommend that patients avoid the type of drops that, quote, get the red out, as vasoconstrictors in these medications can irritate the cornea. There are also gels and preservative-free tears in people who have more significant dry eye problems. Certain medical conditions like rheumatoid arthritis, lupus, Crohn's disease, Sjogren's disease are also more commonly associated with dry eye problems. Sometimes in these patients, artificial tears are not enough to keep the eyes moist, and some of those patients will need cyclosporin eye drops to help keep the eyes sufficiently lubricated. Cyclosporin works by decreasing inflammatory cells in the tear film that attack the gland that makes tears. Eventually, patients will have a better tear film as a result of using these medications. Lastly, some ophthalmologists will put small, tiny plugs into the tear drain over here by the nose. These drains drain tears off of the eye. If you put little plugs in those, you will get more tears to remain on your eyes. Speaking about dry eyes, I'm Dr. Richard Cohn.